Hello. Thank you to all of you who are following this broadcast. Today I'm going to be talking about selective mutism and social anxiety and how to provide or obtain accommodations within the school setting for those diagnoses. My name is Dr. Aimee Kotrba. I'm a licensed clinical psychologist. I live and work in Brighton, Michigan, which is about 15 minutes north of Ann Arbor. And I began specializing in selective mutism about 8 years ago. I kind of fell into it. I was working in a hospital, and a little boy came into our clinic who had never spoken in school, never spoken in public, and had stopped talking to his parents about a year prior to that, which is a pretty severe presentation of selective mutism. But I got really interested in it and began obtaining a lot of information about selective mutism and social anxiety. And now, 8 years later, that's what I specialize in. I recently published a book on selective mutism. And we see a ton of kids and teenagers with selective mutism and social anxiety in our clinic. And with all of those appointments and clients comes working with the school districts, both to, first of all, get kids accommodations within the school and then set up proper and appropriate intervention plans for them. So I'm going to talk to you about the difference between selective mutism and social anxiety, just to give you sort of a 101 class on what those look like, and then we'll start talking about how to best get kids' needs met within the school system. Selective mutism and social anxiety are very similar, and sometimes it's hard to tell the difference between the two of them. And the best way that I can think of to describe the difference between them is that selective mutism is like a specific fear or a specific phobia of talking, sometimes even non-verbally communicating. So kids with selective mutism typically don't talk or don't talk much within the school setting. It's the hardest place for them to talk. And they oftentimes also don't talk much in public or to extended family members or family friends. Whereas kids with social anxiety, it's not necessarily all about talking, but more being the center of attention. The kids with social anxiety always feel like they're on stage and eyes are on them, and they are very anxious about being watched or judged. Whereas kids with selective mutism might be totally fine with being watched as long as they're not talking. So selective mutism is more specific to talking, while social anxiety is broader. About 90% of kids with selective mutism also have social anxiety, so they're very co-occurrent. One of the biggest differences is pretty much the age groups. Selective mutism tends to begin or occur in young childhood, so we get referrals around preschool, early elementary, whereas social anxiety tends to not start until the early teenage years or the late tween years. So in middle school, early high school is when you begin seeing a lot more social anxiety. I'm going to talk about both of them sort of interchangeably today because the accommodation plans and the interventions within the school look pretty similar for the both of them. So how do these diagnoses impact functioning in school? Well, they get in the way in a lot of different avenues or parts of school. Group participation, which is hugely important within the Common Core that's taught at most schools. Group participation is a lot of what the day includes. So working in pairs with other students, working in groups, doing group projects. Giving oral presentations is often difficult for these kids, so getting up and talking in front of the class. Participating in class verbally, especially when you get into the older years of middle school and high school. Participation points are a common part of the points in an overall class. And so if a child can't raise their hand and respond or answer a teacher's question or ask questions of their own, sometimes their points can be reduced in class. Just attending school can be difficult for kids with social anxiety and selective mutism. And so sometimes it gets in the way in simply making it to school. And then just engaging socially with other students. Again, a huge part of school is learning how to get along socially with other students, how to make friends, how to maintain conversations. And if a child has a lot of anxiety about those interactions, then it just gets in the way. So what do parents do when they believe that their child has selective mutism and social anxiety and needs services within the school? Those two are not interchangeable because there are kids who have selective mutism or social anxiety that actually don't really need accommodations within the school. They make it okay. There are other kids who need a few accommodations that the teachers or the school are just simply happy to do without putting together any sort of specific plan. And then there are other kids who need more services. Now, simply having a diagnosis of a mental health condition or even a learning condition does not ascertain that you're going to get services within the school. And the way that the schools define this is not only does the child have to have some sort of quote-unquote disability, but they also have to have an impact on their educational functioning or their learning or their participation in a regular classroom setting. So you have to not only have the mental health issue, but you also have to have a need for services within the school, and that need has to be proven by having some sort of deficit or difficulty within the classroom setting. Now, a lot of parents can easily make that case because their child is unable to participate in oral presentations or group projects or raise their hand or ask for help or tell if they're hurt or if somebody's bullying them or being unkind to them. But for other kids who are a little bit higher functioning, that might be a difficult argument to make within the school. Once those criteria are met, the child has a diagnosable difficulty and they need services within the school, and it's obvious and we have some criteria to say that they do. Really, parents should approach the school with kindness because schools are usually very, very willing to work with parents and usually want the very best for the students. However, coming in like a bulldozer oftentimes doesn't work. And so parents should initially contact the school with kindness and say something like, I'm concerned about my child. Here are the issues that I think my child is having. Can we work together as a team to problem solve and get my child some intervention, some services, some accommodations within the classroom setting? I also strongly recommend that parents send a letter in, a specific letter that is sent in to the principal, the special education director, or even better, both of those people, and the parents should keep a copy of that letter themselves. And the letter should say something like, my child has been diagnosed with social anxiety. It impedes my child's learning in the following ways. And that's where you would list, they're not able to participate in groups, they're not able to give oral presentations, they're not able to successfully alert the teacher if they need help or if they're injured. Due to these deficits within the school setting, I would like my child to be considered for a special education plan or a 504 plan. We'll talk about the difference in just a second. That's going to get the ball rolling because that's an official document that starts the process within a school to consider accommodations or intervention plans. Without an official letter like that, the school technically doesn't have to take any part in it, doesn't have to make any moves within it. So it's important that you write out that letter and that you send it to the principal and or the special education director, and then keep track of any and all correspondence that comes after that. So once the ball has started rolling, the school usually needs to evaluate or consider providing the child with a special education plan or a 504 plan. And that evaluation might be that the social worker observes the child within the classroom setting. It might be giving the parents some questionnaires. It might be further testing like IQ testing or educational testing. There's probably going to be some sort of evaluation that the school is going to do, and then everyone's going to sit down as a team and discuss whether the child meets criteria to get accommodations within the school setting. There are two main kinds of plans for accommodations or interventions within the school setting. One is called a Section 504 plan, and one is called an Individualized Education Plan, which an IEP is what we typically call those. They're slightly different. A Section 504 plan is a state-mandated plan that allows for accommodations within the regular classroom setting. So what that means is that a child could get any sort of accommodations within class, like extra time on tests, taking tests in a separate classroom, having the tests read aloud to them, getting to skip oral presentations and instead do written presentations. All of that happens within the classroom setting, and that's all covered by a Section 504 plan. An IEP is slightly harder to get. There are more criteria that have to be met for a child to obtain an IEP. So an IEP provides not only accommodations within the classroom setting, but it also provides related special education services. So basically anything outside of the classroom setting, like meeting with the speech and language pathologist, meeting with the social worker, being involved in a social group, obtaining resource room, all of those might be met with an IEP. An IEP is a little bit more difficult to get, but it also has more regulations on it. It is a federally mandated program, and so the schools have to write goals and they have to write accommodations. It's a more highly followed plan than a 504 plan. So 504 plans are easier to get. IEPs are harder to get, but once you get them, they're much more regulated. So there's somebody watching to make sure that these plans are being carried out. It depends on the level of severity for the child whether you're going to need a Section 504 plan or an IEP. If pretty much everything can be taken care of simply by accommodations within the classroom setting and no extra people or professional services are needed, then probably a Section 504 plan is completely adequate for the child. If you feel like your child needs pull-out services or needs services with any other kind of professional within the school, you're probably going to want to try for an IEP. So within an IEP, so in order to get those things, to get a Section 504 plan, basically all you have to show is an educational need. So the child has to have usually a medical doctor write that they have some sort of definable diagnosis, and then you have to show that there's an educational need. An IEP, you have to go further than that. The child has to meet criteria to fall in these designation categories to get an IEP. There's all kinds of designation categories. There's categories for individuals with autism. There's categories for individuals with emotional impairments. There's categories for individuals who have physical impairments. The one that's a best fit for children with selective mutism or social anxiety is one that we call OHI, or otherwise health impaired, OHI. OHI specifically covers kids with anxiety because it says that, and I'm reading this, otherwise health impairment means having limited strength, vitality, or alertness, including a heightened alertness to environmental stimuli that results in limited alertness to the educational environment. So that's the argument that I make for kids with anxiety, that their heightened alertness to the social anxiety results in a limited alertness to the educational environment. They're less able to participate and pay attention in class because they're so worried about what other people are thinking about them. It also covers chronic and acute health problems, and anxiety is now considered to be a chronic neurological health problem. So an argument can be made for a designation of OHI. Some schools try to push for EI, which is an emotional impairment, which is sort of a designation that covers a lot of mental and emotional health issues. So the designation for EI, or emotional impairment, is defined as a condition exhibiting the following characteristics that adversely affect a child's performance: an inability to learn, an inability to maintain satisfactory interpersonal relationships, inappropriate types of behavior or feelings, unhappiness or depression, or a tendency to develop physical symptoms or fears associated with personal or school problems. Now, by all technicalities, that might be a slightly better definition. The problem is that kids who are designated EI, there is honestly a stigma for them. When you see EI in a child's file, oftentimes you think of children who have really significant behavioral or emotional problems, which is not a good fit for a lot of our kids with social anxiety or selective mutism. So when I'm helping facilitate an individualized education plan, I'm really pushing for otherwise health impaired to be used as the designation, and that's where I think a lot of professionals are going these days. So once you get either an individualized education plan or a Section 504 plan, what are some things that could be included in that? The child could have no responsibility to do oral presentations. They may provide written presentations instead, or they might be able to do private oral presentations or recorded oral presentations. They might be paired with friends only for group projects, so they don't have to go through that uncomfortable moment of trying to find some stranger in class to pair up with for group projects. Not having to earn participation points, or at least a modified version of participation points, like submitting questions or thoughts to a teacher via email. Being involved in a friendship group. Sometimes schools have what they call social groups or friendship groups, where the children are involved in a group of like-minded peers, where they sit together for lunch or they go running after school is over. But being involved in something that's already set up with like-minded peers, where they don't have to try to start a new friendship all by themselves, can be helpful. If they have selective mutism or really severe social anxiety, they might need individualized pull-out services where they practice what I call brave work, which is practice doing what they're afraid of, practice talking to new people, practice starting conversations, practice their oral presentations before they give them. So that might be being pulled out by the social worker to meet individually. I would definitely recommend that any intervention plans have the child participating at least non-verbally within the school setting. Sometimes kids get passed up. Teachers know that they're anxious and they don't want to put them on the spot, and therefore the child is just passed up. They don't ever even have the opportunity to participate in class, which is not what we want. We always want a balance between not forcing them to do something that's incredibly outside of their ability level, versus we also don't want them to not ever have to do anything that's even remotely anxiety-provoking, because they'll never grow that way. Taking tests in private to reduce kind of the comparison of, oh, everybody's turning their papers and I better get mine in. Some assistance in joining groups at recess or at lunch, so having an adult who can be there to sort of facilitate joining a group and then fade themselves out. And then just allowing for private breaks when the child gets overwhelmed or anxious. So maybe that means being able to go to the bathroom whenever they need to, being able to go out in the hall to get a drink, going into a quiet area of the classroom to just sit and relax and sort of recuperate from that. So above and beyond interventions that they might need within the classroom setting, I also really recommend that parents consider and seek out individual treatment. Both selective mutism and social anxiety are highly treatable as long as you find a qualified therapist who uses behavioral therapy or cognitive behavioral therapy. Those are the gold standards to treat selective mutism and social anxiety. We do have research that suggests that medications can be helpful in treating selective mutism and social anxiety. Typically that is an SSRI like Prozac. Having parents do play dates or scheduled social activities, especially with peers that the child's going to run into at school, those are really important, because parents and the children themselves have a little bit more control over those social interactions. And if you can get a child talking to and comfortable with some peers outside of school, it might carry over into the school setting. Helping kids find something that they're good at and play that up to increase their self-esteem. So making sure that your child is involved in something that they feel really successful at. And then just trying to decrease what we call parent rescuing. So it's easy when your child feels anxious to kind of step in and do things for them to reduce that anxiety, but that actually backfires on us, because when a child is rescued, they really don't have any reason to do things that are difficult or anxiety-provoking. And so trying to reduce that little by little, not stepping in and rescuing them so much, not stepping in and talking for them so much, and just kind of allowing them to feel a little bit of that anxiety, but also learning how to cope with it themselves is really beneficial. I appreciate you listening in today and would be happy to answer any questions that you might have. My email is information@dr, like doctor, KOTRBA.com, drkotrba.com. And my website is Thriving Minds Behavioral Health, all one word, .com. And I hope you all have a wonderful day. Thank you.